And action. Brittany had a question about vitamins for depression, and might sound a little weak, but here's my argument. When you have now, if you have severe depression, forget the criteria for the diagnosis. If you're severe, you really need to intervene with prescription medicines from a psychiatrist, psychology intervention, counseling. It's very important, intense counseling, whether it's inpatient or outpatient. But for mild to moderate depression, I think there's ways to make the outcome much better, or way in your favor that you'll be successful, whether you're on prescription medicines or not. So why do I say that? It's because the average or standard American diet is so crappy. Think about what we do with food, and I think that's the one thing that we can intervene on even before going to any doctor or counselor. The food we eat is supposed to help us rebuild, and these 3 billion cells in here all over are supposed to be able to take care of themselves till you're like 80 years of age. We're seeing diseases now since the millennium that have really escalated, but there's arguments as far as why. However, I think it has to do with eating, because we can intervene with being healthy. Most people know that when they change their diets, they get healthier, they feel young again. And the contrary is also true. Most people know when they eat crappy, they feel lousy. It doesn't happen overnight, but it will get to that point. Those of you who suffer from irritable bowel syndrome, you can eat one bad food and you know the night's going to be tough. So if you change around your diet, you might be able to take away and change moderate depression to mild, or mild depression to no depression. Think of that. So think of it that way, as a chronic condition. And if the chronic condition can be changed with nutrition, great. Now, to break it down as far as getting to the vitamin part, I have a handout from a patient of mine. This is his diet. And he's a great guy, and we're making changes, but if you look at the diet, it's not really that filling. We got a lot of work, but we got like 2 liters of 7-Up. We have some kind of heatable food, fast food, processed food. He doesn't cook, but we're going to learn that stuff. I'm going to send him to a nutritionist. We're going to try to take him away from 2 liters of 7-Up every day. And he's done great. He actually was on 4 liters every day, so he's down to 2 liters. But if I can get that sugar away with substituting water and D-ribose and B12 or other flavored drinks and then fiber and omega-3, I'm giving away the secrets here, but then he can hopefully change this around and then change his life. So if this is standard American diet, which it is, most of us rely on processed food. When you rely on processed food, you're relying on an industry that's they're not worried about you rebuilding your cells. Those 3 billion cells are supposed to fix themselves and make you bulletproof. They're not worried about giving those cells building blocks. They're worried about keeping the boxes on the shelf for an extended amount of time, and that's preservatives. So antibiotics for animals that are all clumped together and get sick, hormones for animals to grow them fast. So if you're a prisoner to that, there's ways to work around it. Check out my tutorial, DrRic tutorial MRE, and you'll see what I sometimes do when I'm in a short amount of time, have to get a bunch of food, meals ready to eat. I picked it up from my armed forces guys. They get good food, packaged up, take it on the go. And anyway, so changing around the food will be important. If you have a standard American diet and you're working on it, cool. If you can't work on it, then at least get the vitamins in, and here's where it goes. So we all need, because of whether you're close to this or not this bad, or you know that you need some work with your diet, okay, fine. You keep on with the diet, work on it, but at least pepper it with vitamins. And what do we need? B1, B2, B3, B5, B6. All the Bs are really responsible for making the mitochondria, the little energy factories in each of your cells, produce ATP. ATP is energy. And when the body can make ATP, you feel energetic, you can problem solve quick, you have a heart that can tolerate stress, muscles can work faster and recuperate fast. Recover fast with your exercises, get a good night's sleep, rebuild overnight, get some thyroid. All this stuff is great, but the building blocks of how these little mitochondria work, are based on these B vitamins. So are we missing B vitamins? Definitely. I think you'll see in a box of cereal, it'll say fortified, but the question is, they're fortified, but then you have all that sugar in the cereal that kind of offsets the fortified. Again, when you have a supplement and it's buried in crap, you're gonna probably neutralize that, and technically you're not getting anything because you have to balance the crap and the fortified multis. I'd rather have you forget the sugary cereal that's supposedly fortified, maybe forget the milk carton that's fortified, just take real food. If you can't take whole food, then you take your supplement. The choices of the multi-Bs. Oh, this is the other thing too, B12 as well. We're missing a lot of B12, and those of you who have to take Prilosec, omeprazole, Protonix, Prevacid, all those acids, all those acid blockers for reflux, which a lot of people are on, they actually turn acid off and stop you from absorbing B12 because you have to chemically cut B12 to get it absorbed. We'll not worry about that detail there, but if you're on those kind of medicines, if you drink alcohol every day, if the lining of your stomach is irritated from tobacco use, you're not going to be able to absorb that stuff. If you're older than 60, the lining is thin. You're not going to be able to absorb that stuff. So if you're on processed stuff, and even if the box says it's fortified, be careful. I would try to get the multivitamin in. Your choice of multivitamin, the higher you go, it doesn't guarantee, I mean, the more expensive you go, doesn't guarantee that it gets in. Just be wise with what you get. I like to get the individual ones, B1, B2, B3, B5, B6, B12. And that's a lot of Bs. So sometimes you'd say you can kind of crush them all into one, and you might be able to do that. But anyway, that's the B complexes. They're important for energy. There's also vitamin D. Usually in Chicago, we have a high amount of seasonal affective disorder. It's sunny now in May, 3rd of May, and I just witnessed another accident. There are 2 accidents in the last couple days. I think everybody's either driving too fast or getting irritated because they haven't seen sun in a while. Maybe it's an overdose of vitamin D, but in Chicago we have low vitamin D, we have a high seasonal affective disorder. So all the studies have shown reproducibly that if you have increased vitamin D, depression gets better. So you can challenge your doc. We can check vitamin D levels, but get yourself on vitamin D. Between the Bs, which are water soluble, you can't really overdose on them, so you don't have to worry about going too high, and the D, vitamin D3, you can overdose on a fat soluble vitamin. You cannot overdose on a B complex vitamin. So water soluble, don't worry about it. Fat soluble, A, D, E, K, those are the ones. Be careful. That's why I'd be very careful with the amount. And check yourself, or have doctor check every 6 to 12 months. As long as you're not going over 70, I think that's okay. I like the sweet spot of getting your numbers at 50 to 70. So that's where I try to push vitamin D. Vitamin E is helpful, but most of the vitamin E's out there are one type of tocopherol. I think you have to have a broad amount of tocopherol, so it's hard to find that, hard to educate my patients on that. It takes too long to do that. I'd rather have you just take vitamin D. So A, the same thing. Sometimes you have to be careful about how to read who packages what, so I would leave A alone, I would leave E alone, I'd probably do D, maybe a little K. The other things are minerals. Minerals are like zinc, magnesium, iron. Magnesium and zinc, I think, are lacking with most of the patients I see. I usually will say zinc is more for my irritable bowel patients. Magnesium is more for my anxiety-heavy patients. But iron, especially if you're a menstruating female, I think iron should be taken in and used as a normal daily routine. The only problem with iron is you have to find a brand that doesn't irritate the gut, because it causes constipation. It's a big molecule, a big mineral. So those are important. There's also DHEA, which is a male hormone. We talked about women maybe using iron if you're menstruating heavy, have painful periods, or you're mildly anemic. Iron would help. It's also helpful for the process of building up things, those little neurotransmitters in the brain, so the brain fires properly. 5-HTP is something that, it's more of an amino acid, but 5-HTP, if you're low on serotonin, it would give you more serotonin, at least the building blocks for it. So I usually save that one for nighttime. Very nice for people who have a little bit of a depression and a sleep disorder. I use it for night, 50 to 100 milligrams. There's also DHEA for men, middle-aged men, who will have a little bit of low testosterone and depression. DHEA kind of perks you up in the morning. You have to be careful. Sometimes there's problems with DHEA and prostate, but the prostate's so controversial at this point in time. I usually like to have blood tests measured in the morning, and then I treat depending on the level of the DHEA and cortisol. So helps with middle-aged men with depression. Then there's finally botanicals. I shouldn't say finally, there's also one more thing. You looked at this diet, and if you noticed, there's hardly any protein, no fiber or minimal fiber, and definitely way too much omega-6. So I guess fiber, if you could consider it a vitamin, it's not really a vitamin, it's a macronutrient, kind of. Fiber, if you increase it, helps the gut, helps pull crap and cholesterol out in your poop. I think it helps. So I like to push fiber for a regular bowel habit. Omega-6 heavy diets like processed food, you might want to add omega-3. So everybody with cholesterol that I see, I always tell them 2,000 milligrams of total omega-3 twice a day, if you can tolerate the price and the smell. But for depression, especially mild to moderate depression, omega-3, specifically EPA, at 2 grams every day has shown an improvement in overall, this is called the Hamilton Depression Rating Scale, with use, at least 6 weeks. The problem, I have enough patients taking the omega-3, total omega-3, it's hard to read and find. I went to Fruitful Yield the other day, happened to walk in with one of my patients that was coming at the same time, and both of us took at least half an hour to go through all the omega-3s to find the right combo, and he was an accountant. So it took us half an hour to go through all the bottles and find the right combo, the right price. If you can find something online or at your local vitamin shop that says 2,000 of EPA or the equivalent of 2,000 of EPA, go for it. If you can't, just get close to it as best as you can, because we know omega-6 is heavy. If you take omega-3 to balance out the omega-6 and maybe trump omega-6, you'll have less inflammation, anti-inflammatory. If you're all omega-6 and no omega-3, you're pro-inflammatory. So pro-inflammatory brings on disease, suffering, pain, inflammation, and depression. So work on that. The final thing I was going to mention was botanicals. And St. John's wort is my favorite. St. John's wort is a botanical. It's a plant, and it has been used and studied, very well studied. Now, there's been doctors who have poo-pooed St. John's wort for severe depression, and no question, it doesn't really work. But for mild to moderate depression, it does work. In fact, there's questions that Zoloft might not even work for severe depression. That's SSRI. But for the sake of considering, St. John's wort 3 times a day is good. 3 times a day is tough to schedule, but it does help. The only problem with St. John's wort is it has to go through the liver. There's a little pathway in the liver to be digested, and a lot of other medicines go through the same pathway. So sometimes St. John's wort will knock off from being metabolized other medicines and get you toxic with the other medicines fast. So check it out with your doctor and your pharmacist or your integrative compounding pharmacist, and make sure that you're safe. Same thing with that did in a nutshell. I was going to say the same thing with trying to eat a whole food, mostly plant-based diet. If you can do that, you might be able to get off of the supplements, perhaps, but that takes investment and that takes training and teaching. So whatever you do, if you're starting to feel the symptoms of mild to moderate depression, please get into counseling. Just taking a medicine is not the key. That's a Band-Aid, and you're taking care of the effects, you're not taking care of the cause. So the root cause of depression might take a lot of working with counseling and psychologists. Eventually, if you can get the tools to change around the way the dynamics in the mind work, you might be able to let go of the suffering and empower or embrace the treatment. So Brittany, I hope this helps. I think you're on your way to stardom, so continue with what you're doing. Just modify, take advantage of all the foods of summertime, and maybe take your pick as far as which of the supplements you should be investing in.